You guys know I sing the praises of More Perfect Union time and time again. Everybody go subscribe on YouTube to More Perfect Union. Everybody go follow them on Twitter. They do the stuff that the big media network should be doing. So they cover labor stories endlessly. Here's what's going on with workers in America. This place is trying to unionize. This place is under attack. Whatever. That's what they do. They do a phenomenal job. So go subscribe. What I'm going to show you here is a little clip from a longer video. So go check out the longer video on More Perfect Union. But it's a little clip of this small Montana town called Libby. This is the one place in America that already kind of has a Medicare for all system, and it was ushered in as a little provision in Obamacare in 2009. Let's take a look and then we'll react.
Libby is the site of one of the worst man-made, corporate-perpetuated environmental disasters in American history. This is how the story goes. Libby was the site of a vermiculite mine. The extracted ore, sold under the brand name Zonalite, was used for all sorts of things. What wasn't widely known for the decades the mine was in operation was that, though vermiculite itself is harmless, it was contaminated with tremolite asbestos. It was later revealed that W.R. Grace, which owned and operated the mine for decades, knew about the danger to workers.
It didn't happen to us, as anyone would like to say. It was done to us.
That's Gayla Benefield. She's
the Aaron Brockovich of Libby.
And that's her daughter, Julie Johnson. Gayla wasn't feeling well while I was in town, so I caught up with her by phone.
Julie called you the Aaron Brockovich of Libby, and that is the best.
Yeah, she's taller than I am. The only way to describe it is it just pissed me off.
Gayla's father, a miner, died from lung disease. Her mother also died from lung disease. And Gayla won one of the first wrongful death suits against Grace over her mother's death.
Grace had bought the company. They bought the company with people knowing they had lung problems. They gave them chest x-rays every year to watch their lung capacity go downhill to see how long they could actually work a man up there before it showed and how long before he died.
So the company knew about asbestos exposure, was monitoring the damage on workers, and instead of telling people, they just tried to figure out how much work they could take out of a man before he died. W.R. Grace closed the mine in 1990.
The W.R. Grace company had a volunteer medical program, but they had a bar of getting access to care that was quite high.
That's Dr. Brad Black. He helped lead the Center for Asbestos-Related Disease Clinic in town, which screens and monitors community members for, as the name suggests, asbestos-related diseases.
And so a lot of people that were having significant health problems from their exposure weren't getting on the health plan.
And then they turned around within 2 years and went bankrupt on us, and we were left holding the bag.
I think Senator Baucus understood that before long, they're going to pull everything. There won't be anything for anybody.
And that brings us back to 2009.
Now is the time to deliver on health care.
As senator from Montana, Baucus was aware of Libby's issues, and as chair of the Senate Committee on Finance, he had the means to do something about it. And that's where Section 10323 of the Affordable Care Act was created.
It is one of those instances where you just, man, oh man, it's clear what had to be done. You just do it. You don't worry about bureaucracy. You don't worry about cost-effective analysis. You just do it, because otherwise people are going to die.
Section 10323 basically gives people in Libby and the surrounding area benefits that nobody else in the country has. For one, it opens up Medicare access for those affected by the asbestos exposure, regardless of their age. And that can be a life changer for people like Julie. Julie was 46 when she was diagnosed with asbestos-related disease. She's been on Medicare through the Libby exception for about 10 years now.
I had no insurance at the time. Yeah, when I got diagnosed, the only good outcome of it was, yes, I did get on Medicare. I was diagnosed with fibromyalgia in probably 2003, 2004, so I had no insurance to pay for any medications with it. Once I was able to get on Medicare, I was able to get the treatment that I needed. I was able to go to the doctors and find out what's the best treatment to deal with the fibromyalgia. So the Medicare has been a godsend for me.
Libby has a current population of 2,775. The card clinic says that between 2011 and August 2021, they had identified 2,281 people in the area under the age of 65 who qualified for Medicare assistance. So, because of these provisions, thousands of people in Libby have benefited. And reporting from the time makes it seem like a seamless process, despite what critics of Medicare for All would have you believe about inefficient government bureaucracy. An official from the Social Security Administration set up shop around the county and saw 60 people in Libby on their first day in town. A little over a year later, about 600 people had been signed up.
Yeah, it was really simple to get on Medicare. Once you go down to the card clinic, they diagnose you. I just had to fill out paperwork. I believe probably got online and was able to get right on the Medicare.
The system isn't perfect, of course, but the interesting thing was that the part people had the most trouble with was the private insurance aspect.
So there you have it. That's a phenomenal story, an amazing story, and something that you never really hear about. Maybe you've heard about it in passing on this show, but you've never heard the specifics of it, that's for sure. I'd never heard the specifics of it. Again, that goes to show the failure that our media is. This idea that Medicare for all is pie in the sky, it's not possible, and then we have a place in the U.S. right now that already has almost Medicare for all. It's not full Medicare for all. You have to have had exposure to that vermiculite or whatever it's called, mine, and so then you have the illness, and once you're diagnosed with the illness, you immediately get into their Medicare for all system. You can see it's actually less bureaucratic, it's more efficient, and the biggest problem with it, as they correctly point out, is the Medicare Advantage part of it. Because Medicare only covers certain things, and then you have to get the Medicare Advantage plan, pay a little more, and then you get a private insurance angle of it. And they say that's the hardest part. That's the worst part. Everything should just be covered with the regular Medicare. So, I mean, look, again, total no-brainer. And by the way, amazing backstory. The guy who pushed for this, Max Baucus, he's a Democratic politician from Montana. This is a guy who was very vehemently anti-Medicare for all. During the healthcare debate, Bernie was pushing for Medicare for all. He was pushing for single payer. And Max Baucus was one of the biggest impediments to that. He was one of the loudest and most aggressive. Under no circumstance will I vote for Medicare for all. Well, Max Baucus wrote the provision that gave Libby Montana Medicare for all. And then when they talked to him here, he's like, look, it was a no-brainer. You had to do it or people are going to die. Max, it's the same thing for the entire country. Because we don't have Medicare for all, 45,000 people die every year because they don't have health care. 30 million people are uninsured. 80 million people are underinsured. About 33% of COVID deaths could have been prevented if we had Medicare for all, because those deaths are attributable to uninsurance. That's a report from Public Citizen that gave us that number. So the thing you said about Libby is true of the entire country. But just understand, all of the arguments, all like the administrative paperwork arguments against it, like, oh, it's too complicated and it's impossible to work out the logistics. Nonsense. It's actually way harder under the current system. One of my friends, his dad is a doctor, and he talks about how the worst part of my job is dealing with private insurance paperwork. It's way easier when you deal with Medicare. And I know you guys are so used to, I've given these facts so many times that you guys can recite these facts back to me better than I could even recite them. But every time we talk about it, I feel compelled to bring it up because maybe this is somebody's first time watching a secular talk video and they don't know the reality of the situation. But the U.S. spends 17% of our GDP on healthcare. We cover fewer people and get worse outcomes. Why is that the case? Because we have a mafia middleman who just takes a cut. Totally unnecessary middleman. Other countries, developed countries, cover everybody and they only spend about 11% of their GDP on healthcare. We're 17%, they're 11%. They cover everybody and get better outcomes. That difference is nothing but price gouging and corporate greed and an unnecessary middleman. There was a study from The Lancet that found Americans owe $140 billion in medical bills. That's about 1 in 5 Americans in the U.S. has medical debt in collections. There's even more than that that's not in collections yet, but eventually will be. $140 billion. And if we were to implement Medicare for all, it would save $5 trillion over a decade. So you save money and you cover everybody and you get better outcomes. And the Commonwealth Fund study has us ranked dead last, 11th out of 11 of the systems studied when it comes to healthcare. There was that old World Health Organization study which had us ranked 37th in the entire world, but it was from like the year 2000. So you could say, hey, look, that's a little out of date now, not even worth bringing up. But the Commonwealth Fund study is recent, and they do it, I think, every couple of years they do it. And we're always last. So the answers are obvious. The answers are right there. And now you know. We already have it in one place in the U.S. I mean, you could argue the way Medicare works, even though there are problems, you know, Medicare, you need the Medicare Advantage, so there's a private angle to it as well. It doesn't cover dental or hearing or eyes. But, like, we already have one version of a single-payer system for old people in the country. And guess what? It polls as the most liked healthcare in the country. And there's less waste and abuse. Much less when you compare the private numbers to the Medicare numbers. So the answers are obvious. It's the corruption that gets in the way. But now you know the story of the specific Montana town that already has Medicare for all. So don't let anybody tell you, oh, maybe it's possible in like France or Canada, but it's definitely not possible here. Thanks, bro. Are you getting a check cut directly from Humana and Aetna into your bank account, or are you just so stupid that you repeat their propaganda uncritically? You tell me. Ever since Adpocalypse, when YouTube defunded all independent news and politics overnight, we haven't trusted them. We know they can pull the rug out from underneath us at any time. If you enjoy this content, please consider tipping $1 or $2 per month on the Secular Talk Patreon. Link in the video description box below. Thanks for your support.